Now we're on page 11 of the document and ADL3, breathing and circulation. So the first part of this nursing assessment, we document the patient's admission observations, their blood pressure, pulse, respiration rate and oxygen level. Then we go into the patient's history of acute or chronic illness or condition, COPD, asthma, CCF, pulmonary fibrosis, sleep apnea, others. So we can document, tick whichever applies here. Is the patient breathless on admission? Yes or no. Use of accessory muscles? Yes or no. Does the patient have a cough? Yes or no. If the patient has a productive cough, send sample for CNS. Is oxygen therapy required? Yes or no. Is non-invasive ventilation required? Yes or no. Oxygen delivery device and flow rate or percentage of oxygen, including aerotherapy, you can document that there. Is the oxygen prescribed with a target SpO2 stating yes or pending? Peak flow monitored required? Yes or no. Is the patient on inhalers? Yes or no. Is the patient's inhaler technique satisfactory or unsatisfactory? Has the patient got a home nebulizer, home oxygen or home NIV? Yes or no. Has the patient got a smoking history? Are they a smoker? Yes or no, or ex-smoker? Have they been informed of the tobacco-free campus policy? Yes or no. Brief smoking cessation advice given? Yes or no. Offer use of nicotine replacement therapy? Yes or no. Okay, so you can see all those answers are tick boxes. Yes or no, so there shouldn't be any blanks on that assessment. So if we identify from our assessment that the patient has an issue with breathing, then we can activate Care Plan 3A. Patient is experiencing breathlessness or altered respiratory function and cough. Okay, so you tick whichever is applicable for your patient. The expected outcome, optimal breathing pattern is maintained and returns to patient's normal limits. So the nursing interventions here, this first one, this intervention is highlighted in yellow, so this needs to be activated for every patient. Monitor vitals and oxygen saturations and escalate as per NEWS or IMUSE protocol. ISBAR used to alert and report abnormalities. ISBAR sticker placed in medical notes. Assess consistency, quantity and colour of patient sputum. Obtain sputum sample, ensuring sputum container is beside patient's bedside. Administer prescribed oxygen therapy to achieve the patient's target SpO2 saturations. Titrate oxygen therapy to achieve target O2 saturations 88 to 92% if patient is at risk of CO2 retention, or 94 to 98% for all other acutely unwell patients. If a patient has increased respiratory rate, work of breathing, use of accessory muscles or increased requirements, liaise with physiotherapy or respiratory nurse. Administer nebulizers as prescribed. Dispose of the nebulizer kit after each use or as per manufacturer's instructions. Teach and encourage deep breathing exercises. Check respiratory nurse referral sent if appropriate. Assess inhaler technique. Demonstrate correct technique if suboptimal. Educate as appropriate. Follow non-invasive ventilation guidelines and request respiratory bed. Check physiotherapist referral sent if required and ensure they are notified if patient is on airvotherapy. Wean patient from oxygen therapy when stable and maintaining target O2. If weaning unsuccessful, inform medical team as patient's care may need to be optimised further or consideration for home oxygen therapy. And then you have some blank interventions here that you can write in your own interventions for your patient. Okay, so again, you activate whichever of these interventions are relevant for your patient. The next part of this assessment is circulation. So we look at our assessment first. Does the patient have a cardiac history? Yes or no. So their cardiac history may be myocardial infarction, angina, congestive cardiac failure, atrial fibrillation, cardiac stents, CABG, other, or you can specify. Okay, so you tick whatever is relevant for your patient. Maybe your patient has cardiac risk factors, diabetes, family history, BMI greater than 25, hypertension, increased alcohol intake, smoking, stress, hypercholesterolemia, sedentary lifestyle, less than 30 minutes of physical exercise per day or 150 minutes per week, devices, example internal defib, and you can specify there and document your comment there. Okay, and then on to the care plan. 3B, circulation, altered, related to, and you can document your reason there. The expected outcome, achieve optimum cardiac or circulatory function. So the nursing interventions, so we read down through these and we activate whichever is relevant for our patient. Monitor and apply anti-embolic stockings if prescribed and monitor daily. Monitor for chest pain. Monitor blood results for patients receiving anticoagulant therapy. Weigh patient daily and document a news chart. Commence telemetry with CCU monitoring. Administer diuretic therapy as prescribed. Maintain strict intake and output. Adhere to recommended fluid restriction, and you can specify what that is there. Provide low sodium, no added salt diet. Palpate pulse to check for irregular heartbeat. Observe for signs of heart failure. Complete angiogram checklist. Liaise with appropriate CNS, and you can document who that is there, and liaise with dietitian. And again, we have blank spaces here to document your own interventions.